I am honored to be the moderator of this morning's broadcast. I think that you will enjoy it. I think you will learn a lot of new information as you hear from my co-presenters this morning. Next slide. Here's the overview of what we're going to go through this morning. I'm going to present an overview, the data about bullying among adolescents, and then I'm going to turn it over to Dr. Espalage to talk about cyberbullying and electronic bullying, to give you some information about those populations at highest risk, to talk about prevention and systematic change, and then we will transition over to Mr. Aponte to talk about his story, about how he turned his experience into positive action, and then I will address the last issue about solutions and action steps to identify, prevent, and address bullying. And then we will open it up for the questions and answers from all of you. Next slide, please. So what is Healthy People? You have here some points about what it is. It's a national agenda that communicates a vision for improving health and achieving health equity for the entire country. It's frequently called a roadmap for health promotion and disease prevention. It's really about understanding where we are now and taking informed action to get where we need to be. And really the guiding principle behind Healthy People is that by setting national objectives and by monitoring our progress, we can motivate action. And I think the prior experience with the Healthy People 2010 objectives has shown us that that is possible. Preliminary data suggests that of the 2020 objectives, about 71% had positive progress made or were achieved. So that's encouraging for these 2020 objectives. Next slide, please. These are the different ways that folks have used the Healthy People 2020-2010 objectives in the past in ways we anticipate that they would use the 2020 objectives moving forward. As a tool to measure program performance, as a framework for both program planning and developing new programs, as a tool to set agendas and goals, and these really apply at both the national, state, and local levels, as well as a tool to teach public health courses as benchmarks for which states and locals can compare their data, and as a way to develop and encourage non-traditional partnerships. So here's the healthypeople.gov website. I think most of you or many of you have visited that site in order to register for this webinar, highlighted here at the top of your screen, as well as a plethora of other webinars that you should definitely investigate. And this is the site that you need to go to find out more information about Healthy People 2020 and more information specifically about the injury and violence goals if you are interested. Next slide. Here's the specific goal related to bullying prevention within the injury and violence prevention subsection. You see here that the 2009 Youth Risk Behavior, or YRBS data, had about 20% of students indicating they were victimized on school property during the year before the survey. Our target setting method is a 10% improvement upon that goal, and that leads us to a target of 17.9%. Of course, any amount of victimization is unacceptable, but this is what we feel is a reasonable and achievable objective over the next 10 years.